If injuries linger, workouts are just leaving you feeling erect, and sleep no longer really restores you, remember those are not random signs of aging. They're actually signals that your repair system is really just underperforming. If you're new to my channel, hello, my name is Steve Jones. I'm a medical doctor in Texas. I've specialized in longevity medicine. I focus on getting my patients the most out of their life. And today what I'd like to talk about with you is a powerful but often misunderstood tool that we use in longevity medicine all the time, and it's peptides. Now, specifically today, I want to explore how certain peptides may support recovery, resilience, and healthy aging. And just as importantly, who they're for and who they're not for, and how they should be used in a responsible manner. So let's start with just a few basics here. Remember, peptides are these short chains of amino acids. They're the same building blocks that make up proteins. Think of them as precision messengers in our body. Now, each peptide has a very specific job. Some signal tissue repair, some influence inflammation, and others support mitochondrial health, immune resilience, cellular communication. The list goes on and on. Unlike medications that often force the body in a certain direction, peptides tend to work with existing biological pathways, which is why they've gained so much interest in longevity medicine. One of the most overlooked drivers of aging isn't just time, it's incomplete recovery. Now, poor recovery leads to chronic inflammation. It can cause hormonal disruption, a loss of lean muscle tissue, and an increased risk of injury. So over time, that erodes performance. It erodes our vitality, and it starts to infringe upon our health span. So supporting recovery isn't really all about just bouncing back faster to do more damage. It's really more about restoring balance so the body can adapt, it can rebuild, and it can stay resilient. So there are 4 peptides that I'd like to talk about today. One of them is super popular. It's called BPC-157. It is one of the most well-known peptides in recovery medicine. BPC-157 has been studied for its potential role in supporting tendon and ligament healing. It's pretty robust results, but they're mouse studies. It helps to promote gut lining integrity, can be used for all kinds of problems with the intestinal tract. And it's been shown to enhance blood flow to injured tissue. So at Revive, when appropriate, it's considered in patients that are dealing with nagging and persistent musculoskeletal strain, slow tissue recovery, acute injury, and then to try to help heal up some problems with the GI tract. The second one is TB500. It's a fragment of thymosin beta-4. So this peptide is often used alongside BPC-157. In fact, they're stacked together commonly in a stack called Wolverine. Great marketing name, right? But TB500 is involved in cellular migration. It helps with tissue remodeling. It helps with recovery from repetitive stress. I tell my patients often that this is a really great anti-inflammatory. It's not about masking pain. It's more about supporting the repair process itself. And it works really good with great medical supervision on top of it. The third peptide is a combination of CJC and Ipamorelin. Now, these peptides influence growth hormone signaling. Remember, growth hormone is something that starts to really wane after we turn maybe 40 or 45. So growth hormone plays a big role in things like muscle repair. It helps with fat metabolism. It's really important for sleep quality and then for overall recovery capacity in general. When used appropriately, the growth hormone peptides can optimize our body's natural repair rhythms, particularly overnight. Remember that growth hormone is released in the first 4 hours of sleep every night. So we take these growth hormone secretagogues before bedtime. We get more natural growth hormone release overnight, and that facilitates better repair, better recovery, and a better night's sleep. The fourth peptide that we'll touch on today is called Thymosin Alpha-1. Remember, recovery is not just about our muscles, it's also about our immune system. Thymosin Alpha-1 has been studied for immune modulation, resilience, and it can be especially important in people who are experiencing chronic stress, frequent illnesses, and then just like prolonged inflammation where you feel stiff in your joints and maybe swelled up. So longevity, remember, isn't just about living longer, it's about staying robust. Now, this part is critical, and I've got to say it just in summary here. Peptides are not supplements. They are prescription-based therapies that should only be used under the guidance of a qualified physician. They're not FDA approved for anti-aging, and many of the uses that we do with them are off-label. That means that they're guided by emerging research and our clinical experience, but it shouldn't just be done because of marketing claims, especially with so many companies out there really pushing peptides. Peptides are not appropriate for everyone. So that's why at Revive, we never use a one-size-fits-all approach. Every patient is evaluated individually with labs as necessary, a good history, and then talking about your goals, risk factors, and all of these things being carefully considered. So look, none of this stuff in the video today needs to be taken as medical advice. If you're considering peptide therapy, you should consult with a qualified physician who understands longevity medicine and is experienced in the use of peptides. I also want to say this clearly. Peptides do not replace fundamentals. If your sleep is broken, if your nutrition is chaotic, if your stress is unmanaged, if your training is excessive or non-existent, no peptide is going to save you or replace all of those things. Peptides work best when layered on top of intelligent training, proper recovery, good balance of hormones, and a well-regulated nervous system. Peptides are amplifiers. They are not shortcuts. Look, if you're a driven professional entrepreneur, if you're wanting to recover better, age stronger, if you're wanting to stay sharp for decades, peptides might be a tool worth exploring, but please do so the right way. At Revive Longevity Center, our role is to help you make informed, medically sound decisions, not just to chase trends. So thank you for watching. If this was helpful, I'd love it if you would subscribe, and even better if you would share it with somebody that needs to hear it. I'm Dr. Jones. Be well and take your recovery seriously.